Welcome, everyone. My name is Brenda Merritt. I am the Dean of the Faculty of Health, and it is my absolute pleasure to be here today. Very exciting. I have a few words just to welcome, and then we'll turn it over to the town hall. So, Prime Minister Trudeau, members of Parliament, Andy Fillmore, Darren Fisher, Daryl Sampson, Jaime Baptiste, university leaders, and students from Dalhousie, St. Mary's, NASCAD, the Mount, and the Kings. I'm thrilled to welcome you. Before we kind of begin our formal event here, I will first acknowledge that we are gathered today on the ancestral and unceded territory of the Mi'kmaq people. We are all treaty people. I also want to acknowledge the histories, contributions, and legacies of the African Nova Scotian community who have been here for more than 400 years. We are honored, turn around and face you guys too. We're honored that the Prime Minister Trudeau is here today to speak with students about one of the most important and most personal topics of health. Mr. Trudeau entered politics to foster change. Since forming government in 2015, he's steered the country through the most significant event of our time, the COVID-19 pandemic. Never has healthcare been more front and of mind for our communities and Canadians. In this context, he and his government recently negotiated a historic new federal health deal with the provinces. Today's healthcare town hall promises to be a fascinating exchange of ideas. I went up on my notes a little bit there. And we are so pleased to host it here at Dalhousie at the Collaborative Health Education Building, which you'll get a chance to see a little bit of. And before I invite Premier Trudeau to take the stage, a few housekeeping notes. We have a full house here, standing room only. And with the student exchange, I will ask you that you raise your hand and somebody will come around with a microphone. And when it's your turn, please try to keep it to just one question so that others can have an opportunity to ask questions and to exchange. But without further ado, I will introduce the Right Honourable Justin Trudeau.
Thank you very much, Brenda. Thank you all for being here today. It is a real pleasure to be back here at Dal, back in Nova Scotia. I think the last time I was in this building was during the election campaign where we were making an actual announcement around health. And talking about healthcare, particularly in this building, and I know many of you are healthcare sector students, so those may be some of the questions you have, but this is really as much an opportunity for me to hear from you on whatever it is you are preoccupied with. There's a lot going on in the world right now. We've gone through some really, really challenging years, whether it's just the general times we're in, where there's a lot of transformation of our economy, of our globe, of our dynamics, of the pace of change. Challenges like climate change and geopolitics been hitting us hard over the past many years. Add to that the pandemic that, of course, directly impacted you as students, whether you were already in university or whether you were finishing up high school. Those years of pandemic were a real challenge that you had to overcome alongside the rest of us as well. And despite, or perhaps because of that pandemic, many of you chose to get into the healthcare stream. And that is unbelievably important. Canadians have seen just how important our healthcare professionals are throughout the system, and it's great to see you all stepping up on that. But there have been more challenges than just a pandemic. We've been grappling with a rise in mental health and anxiety issues that have led to conflicts and challenges. We've seen a real increase in intolerance in some corners, rise of anti-Black racism, anti-Asian racism, recognition of some of the systemic barriers and challenges that exist in all of our institutions throughout our society that people are increasingly grappling with, and that in many cases young people are leading the way on in terms of awakening to the responsibilities we have to create a much more inclusive and respectful space and success for everyone. We're also dealing with geopolitics as the world is changing in its pressures and its poles, as we're seeing the impact of war returning to Europe, as Russia has decided to invade Ukraine and upend the 75 years of peace and stability that we had in so many parts of the world that led to significant prosperity and opportunity for billions of people around the world, now being caused into question. Russia is desperate to try and prove that might makes right once again. And that has implications not just for countries around Russia, but it has impacts potentially all around the world, wherever there's a country with a slightly larger army than their neighbor. If Russia succeeds in what it's trying to do to attack, destroy Ukraine, not just as a country, but as an identity, then that has impacts everywhere around the world that we have to be alert to. But of course, the impact of the pandemic, the impact of the war in Ukraine has had very real impacts on our lives, with increases in inflation as energy shortages in Europe have rippled around the world. Increases in disruptions of supply chain that have led to higher prices on so many things. And that inflation has in turn led to higher interest rates, which is also putting pressure on people. So we're in a really tough time right now. There's no question about that. And whenever the economy is challenging, students end up carrying a huge brunt of that. And that's why I'm so pleased to be hearing from you at this time, because it is so unbelievably important to all of us that you are able to succeed, that you're able to fulfill your potential, that you're able to make it through these years where you're learning, growing, developing into people who will be able to not just contribute to society for the coming decades, but shape the society and the world we live in for the coming decades. And so much of that right now is layered on this anxiety that so many people are feeling about where we are in the world, about where they are, how they fit into a world that is more difficult, more chaotic, and real impacts that are happening in their daily lives. One of the areas where we see that is around healthcare. Now, we know that our healthcare system is a huge point of pride for so many Canadians. Having public, universal health care is something that distinguishes us from our neighbors to the south, but it goes to the heart of who we are as Canadians, understanding that for any of us to succeed, all of us have to have a real and fair chance to succeed. And that principle of public health care is really important. But if we're going to be honest, it's not just the pandemic that has shown that our healthcare system is struggling to meet the ideals that Canadians put forwards on it. Canadians believe it should. And that's why we recognize throughout the pandemic, even during the pandemic, the federal government, which isn't in the business of delivering the healthcare systems across the country, that's the role of the provinces. The Constitution sets that up, and that's the way it works. But the federal government does have a really important role to play in two areas. The first area is making sure that the Canada Health Act is respected, making sure that we continue to have a universal, accessible healthcare system that is public. And that's something that we're absolutely committed to, because Canadians really care about that. But the other role that the government has is to help fund healthcare systems across the country. And we've been doing that at significant levels. We send about $45 billion a year, every year, to the provinces. But on top of that, during the pandemic, the federal government spent about $72 billion more for everything from PPE to vaccines to just extra injections of cash into the healthcare systems to be supportive through these difficult times. So one of the things we said throughout was we would also be there to invest in the long-term future of our healthcare systems, because we know there is a need to do it. Now, I'll be honest, over the past many years, every 5-10 years, depending on the cycles and the governments in place, federal government sits down with the provinces and negotiates more money to send into healthcare. And that's fine, and it's important. But the challenge is, the way our Constitution is set up, the federal government isn't the boss of the provinces. We are partners in running this country. The federal government takes care of sort of the national and international things, whether it's foreign policy, military, federal taxes, things like environment or things that cross borders, protecting French and English. These are all things that we do as a federal government. Provincial governments deliver social services, whether it's K-12 education or healthcare. Those sorts of things is quite responsibly something that varies enough from province to province that the local provincial governments deal with that. So we don't get to say, okay, this is how you have to spend your money on healthcare. Because provinces have the expertise and provinces are connected and provinces run the systems. But what we've done slightly differently this time is say, okay, we're going to send you money on healthcare, but it's going to have to be in 4 different areas. And one of those areas is data, transparency, and accountability of results. You all know how important it is to collect good data in healthcare. And the idea of someone showing up at an emergency room and the doctors there have no idea what specialists you've just seen, what tests you've just had, even who your family doctor is, particularly whether you do have a family doctor or not, and that's something is one of the other priorities we have. Or the fact that we have 13 different major health systems across this country with our 13 provinces and territories, and yet we cannot compare outcomes from one to the other because everyone collects data slightly differently, is a barrier to actually learning from successful innovation from one area to the other. And for Canadians who choose to shockingly move from one city or one region to another, making sure there's a continuity of care and an ability. I know lots of students here, not all of you are from Nova Scotia. Many of you are from not just across Atlantic Canada, but across the country, and you should be able to have access seamlessly to the health records and the health care that you need. So getting better information will ensure better outcomes, both within the systems and across the systems, and it will make sure that we're actually delivering those results. The other 3 areas we're focused on: access to primary care doctors or primary health teams. We know that getting a family doctor is the ideal portal into the healthcare system to get you to the right specialists if you need that. You have someone who knows you, knows your family, has tracked you for a while, knows what your mental challenges might be, knows the context of your lives, is that touchstone that will help accompany you through whatever challenges or not you're facing in the medical health system. Making sure more Canadians have access to a family doctor is key. Understanding also better mental health supports. Mental health is health, particularly when it comes to young people. Making sure that you are getting the tools and the support you need around mental health early in your lives as symptoms or challenges start to articulate themselves is the best way of ensuring that you will be able to flourish throughout your lives with the tools necessary to make sure that you're keeping your mental health in the best possible shape. And that is why looking at mental health young is important, but also understanding that it's not an isolated, separate area of healthcare. It's something that should be woven through our entire system. A more holistic, more community approach to healthcare, for mental health, is going to be a really important part, and that's part of what we're doing as well in these negotiations. And finally, making sure we're properly supporting healthcare workers, making sure they're properly paid, making sure there is a continual relief or new waves of young people and of professionals coming in to join the healthcare system and not getting burned out within a few years and choosing to switch careers, as some people have. Making sure we're properly supporting people throughout their careers so they can mentor and they can support people. Making sure we're recognizing foreign credentials more quickly. Making sure that there's national licensing so that people can travel to where the jobs are and where the needs are. These are things, and of course improving the conditions of work, because we know working conditions in the healthcare system lead to better care conditions in the healthcare system and better outcomes for people. So those are all the things we're focused on healthcare. But there is so much more that we're doing, and so much more that I know is preoccupying to all of you. So with that rather lengthy introduction, where I did want to lay out a little bit of the approach we're doing on healthcare, and actually good news this morning, which I wasn't supposed to announce till later at a press conference, but I'll give you guys a little preview. We've actually just confirmed agreements in principle with the 4 Atlantic provinces and Ontario, who've said, said, yes, we're in for these healthcare deals. Let's start negotiating the details on how many family doctors we want to add, what we're going to be investing in mental health, how we're going to move forward to get the best possible outcomes for Canadians over the coming years. So that's fresh off the press this morning, that a whole bunch of provinces are raring to go. There's lots more to do. With that, I am now happy to start turning it over to questions for you, and we'll start with someone in this section. Here you go, you in the green shirt. Yeah, it's just coming right to you. Or you can give it to her, and you can give her the mic.
Thank you. So nice to meet you. So happy to be here.
What's your name?
My name is Alex Bromley. I am at the Mount, and I am a master's student in applied human nutrition, and I have just applied to Dalhousie Medicine, so keeping my fingers crossed there. My biggest concern, these are really great initiatives to have, but my concern is preventative medicine, preventative healthcare. To make things better for healthcare workers, we have to be able to remove the burden that's being placed on our hospital care systems. This is a conservative number, but half of Canadians are going to die of a nutrition-related illness, and your average doctor is only getting about 10 hours, 15 hours of nutrition training. But they can't see a dietitian. We can't see a psychologist. People can't buy their health care or their medicines that they need to take care of themselves. To take care of your mental health, some of us need to have medications, but we can't afford those medications. And then you can't take care of yourself, and then you end up back in the hospital. So I guess my question is, I want to see prevention. We need to stop people ending up in hospital, not just dealing with the people that are there, because right now the system that we have is a Band-Aid, and it's symptom management, and it's not preventing people from ending up in hospital.
Listen, that's a great point, Alex. We have seen successfully over the past number of years a shift away from a purely institutional model that we had decades ago to understanding that home care, community care, self-care are all huge, important elements of it. We also see a shift away from surgical interventions and institutional interventions to better pharma treatments, more sophisticated personalized medicine, personalized drugs, which is of course why we're continuing to work to bring down drug costs while encouraging innovation at the same time. That's a big part of our push towards pharmacare. But there's a whole lot we need to do about healthy living as well. And when we look at the social determinants of health, where we make sure that people can actually find a good home and afford it. And housing is part of healthcare, it's part of health. Making sure that we're dealing with anxiety around finances and anxiety around communities and how we're living. Understand that all those elements go into it. Knowing that we have to do a better job of keeping people healthy so they don't end up in the sick care system, so they don't get sick. And that's that's where governments have an important role to play in making sure we're promoting and ensuring access to good food, good nutritional information. We made a change recently to the Canada Food Guide. We're moving things along in the right way. But one of the challenges we always face in politics, so much around politics is short term. And so much of things are, you get credit for fixing problems. You don't get credit for preventing a problem from happening in the same way. And the more we get to keep people healthy, the more we get to invest in giving people better choices, and the more we make sure that your access to a family doctor isn't going to send you there to the emergency room because you have no other place to get into the healthcare system. Making sure that you have a primary health team that, maybe you don't need to see a doctor. Maybe you need to see a nutritionist. Maybe you need to see a psychologist. Maybe you need a physiotherapist. And if you're showing up at an emergency room needing that, we've got a really inefficient system. So how we actually look at putting people at the center of what we're doing and actually not focus as much on how you treat people as how you engage with people, how you actually value them, listen to them, hear them, and respond to them in real human ways and understand the scope of the problems that maybe it's not a hospital room and a hospital bed that is going to be the right solution for them. The more we have a system that will not just be better to respond to individual needs, but will be more able to do it because we won't be putting all the resources into a single model and a single way of treating such a range of things. So I thank you very much, Alex, for bringing that up as a really important point. Question from over here now. Yeah.
Hi, it's a pleasure to meet you. My name's Madison. So, in healthcare, it is well established that best practice involves using research to guide patient care, which results in a better utilization of resources and enhanced patient outcomes. However, many healthcare professionals in Nova Scotia, such as nurses, have no access to specific databases to review new scientific publications. At a federal level, what actions is your government taking to increase the access of healthcare professionals to research to guide their practice?
Well, I think one of the reasons people aren't getting access to the kind of professional development, the kind of updates and innovative solutions that are being developed is everyone's pretty stretched right now. Everyone's pretty overwhelmed in a lot of ways. So even if there was better access, taking time to do that professional development, to get up on the latest research, when you're just trying to, keep things going in a way that is already stretching you really thin, becomes difficult. But we know we need to. So first of all, we need to make sure that people do have those kinds of supports. Yesterday, I sat down with a group of PSWs in Ontario who were saying that when someone calls in sick or when someone's overwhelmed, they can't come into work, rarely are they replaced. So it's the folks who are there who take on more and more and more, and that becomes a cycle that's hard to get out of, because those people who are taking on more themselves are more likely to burn out, and you can never get ahead of it that way. So making sure that there are enough people in the system, enough abilities in the system to be able to take that time to read the latest research, to do that professional development as a matter of course, and not know that you're going to be leaving your patients or your community in a lurch because there's no one to replace you when you're off developing and improving, is a really important piece. So it does go to the core of making sure that our healthcare workers are sufficient and encouraged and supported with the right kinds of resources. But it also goes to the idea of better data, better information, accessed in a much more timely and easy way. When we have a system that can actually speak to each other across the country, when you have a medical file that will follow you from specialist to specialist, when you have, as medical professionals, access to the right and timely information around what's working and what's not, it's actually a lot easier to know what the best research is telling, what the best outcomes are going to come, when it's not as ad hoc and it doesn't depend on, oh, I actually found out if you do these pills in this order, it does a different thing than if that, and it just happened by accident, but here's the report, and it actually is worth trying. If nobody's noting that down, if nobody's sharing that kind of experiential data, if everyone's just trying to scramble to keep their heads above water, we're not getting the kind of innovation, we're not getting the kind of thoughtful, engaged care that I think Canadians need and deserve. So it's going to be really, really important that you have access to research. It's really important that we blend the research stream with the clinical side as well. There, you will all know different institutions in different places across the country, or I certainly do, where they're really known for their research, but the clinical side of things is a bit of an afterthought. And other places that would love to do a little more research, but they're really focused on clinical and they can't do the research side. Making sure there is better communications, better flow of answers, solutions, data, and practices across and within our system will give you, as future health professionals, all the tools you can to be giving the exact best care to the people you choose to serve. So thank you for your question, Madison. Another question from over here. Yes, you in the white sweater.
Hi, my name is Liam. I'm at Dalhousie. I'm the first year of the MPA students. My question is, if the provincial government started adopting healthcare policies that you consider very un-Canadian, say like a rapid shift to privatizing healthcare, what policy tools would the federal government have to discourage that and protect its citizens?
We give about $45 billion a year to healthcare systems across the country, to provincial healthcare systems. We just signed, or we're in the process of signing agreements for about $196 billion to provincial and territorial systems over the next 10 years, with I say 198 because there's an extra $2 billion that is specifically for Indigenous health on reserve. But we have in the past, in certain jurisdictions, the health minister has clawed back money that we have or withheld funds to provinces that are not living up to the Canada Health Act, either because of private practices or other things that violate the Healthcare Act. I mean, there's a range of systems, but across the country in how people choose to deliver healthcare, but making sure that the quality of care that you get is in no way related to your ability to pay or not is pretty fundamental and really valued for Canadians. Now, one of the challenges we have lately is, the healthcare system just isn't working very well for Canadians. So people who are advocates of more privatized system find it a little easier to say, well, see, the system doesn't work, and therefore we need to bring in a different model. It's the fact that it's a public system that's causing the system to break down. Well, that's simply wrong. There are lots of things that we can and should be doing within the public system that will be helpful. And as a federal government, we will always stand up to defend the Canada Health Act, and that will include what we've done over the past years in certain cases and what we will continue to do, which is withhold or pull back money from the provinces if they are not fully living up to the Canada Health Act, because it is foundational and fundamental. And I refuse to accept the argument that some people are making that, oh, you know what, the only way we can improve the system is to create a two-tier or a private system. It might well improve the system for a few people who have the ability to pay, but it will not improve the system for everyone. And that's something that as a government we are always going to stand for and stand hard on and ensure, as we're renegotiating healthcare deals, as we're talking about top-ups to Canada Health Transfer, as we're targeting metrics and outcomes that are going to deliver. That is part of, if they want to keep getting money through these 10 years, they have to abide by the Canada Health Act, and they have to be much better on data collection, data integrity, data sharing, in order to be able to be delivering results for Canadians, and we're going to be watching that carefully. Thank you. Another question? Yeah, right there.
Hi, I'm a student at the University of King's College.
What's your name?
My name is Tasha. My question for you is that we are all here as students. Nova Scotia has the highest tuition in Canada. It's an average of $9,328. The national average is $6,834. While there are federal programs like tax credits and increased grants, they are not keeping up with inflation, and student debt is at an all-time high. So it's clear that these programs are failing students. What specifically will the federal government do to address the national student debt crisis? And how are you planning on making education more affordable for students? Thank you.
That's an excellent question, Tasha. And I can see a really important one. The federal government has a significant role to play in making sure that post-secondary education is affordable across the country. It matters to Canada that wherever you go to school across the country, and wherever you end up working across the country, whether it's in the province you grew up in or in another place, that you have the best quality education. We need to make sure that everyone in Canada can make the right choices for them and doesn't see financial barriers as a reason for them not to continue their studies, not to follow their dreams, not to be able to get the best possible education they can. And Canada's been successful over the past many years. We are the best educated country in the OECD, which is a large collection of developed and highly developed countries. But there's always more to do. So the federal government has a framework around student loans and grants and bursaries and supports that are significant and right across the country. We've recently doubled the amount of student grants, particularly focused on the challenges of the pandemic. But we've also moved forward in the pandemic to eliminate student interest payments on student loans through the pandemic, but we've made that now permanent. There is no more interest on student loans, which at a time of rising interest rates is of concern. So that is going to make a difference. So we've increased the thresholds so that you only have to start paying back your student loans once you're making a minimum of $40,000 a year. You also we've reduced from 20% to 10% the maximum amount of payments you have to make at any given time onto paying back your student loans. So we've done a lot of forgiveness. The other piece is if you're graduating as a doctor or a nurse, there are massive and generous loan forgiveness programs if you're going to go work in a more rural area or a more underserved area as an incentive to make sure that we're getting good healthcare professionals right across the country. And Halifax, in Nova Scotia, it means pretty much anywhere outside of Halifax counts. But it's initiatives to make sure that we are supporting people to not worry that they're not going to be able to pay back their student loans. And that's a big piece of it. But we also know you are challenged with costs right now, from inflation hitting hard right now, to rents going up, to challenges around finding time or abilities to get those good paying jobs while you're working at an overwhelmed level. There are real challenges out there, and we've looked at direct supports that we can send. We doubled the GST rebate last year for 6 months to give extra help through the fall. We're moving forward on dental benefits in the coming years, now for kids under 12, but we're moving forward on dental benefits that are broader than that over the coming years. So everyone can have access to a dentist. We've got extra supports for low-income renters. There's lots of things we're doing, but one of the core elements of your question, Tasha, is it's particularly difficult in Nova Scotia. We have a country where different provinces take different approaches on these sorts of things. And our job as a federal government isn't to critique one part or the other of the country, as long as they're making decisions that are supported by their populations. But it's also not to compensate for provinces that make decisions that make certain things more expensive to a greater degree here in Nova Scotia than elsewhere. So we have lots of federal supports. We will continue to try and encourage people to bring down tuition costs, make sure there are lots of reasons for you to be able to feel confident about going into debt so that you can finish your university education, knowing that you will be able to pay it back with the kinds of supports and with the kinds of good jobs that'll be out there. Because we know that this is a big investment in your future that we're making, and we know that it's the right investment. So the combination of these things means that we're always looking for what we can do more to support students, particularly through this time. But it's something that we do together with and alongside provinces that I think can always do more as well. Particularly since during the pandemic, the federal government spent about 8 out of every $10 that went to Canadians on pandemic aids. We stepped up hugely during the pandemic with things like CERB, with the CEBA, with supports for young people, supports for seniors, supports for small businesses, all those things that ensured that our economy could come back strongly, that people were kept safer during the pandemic. That actually sort of shifted the balance sheets away from where the federal government was in great fiscal shape before the pandemic to now the provinces are in far better fiscal shape than the federal government post-pandemic. Now, not to take anything away from the federal government, we still have the lowest deficit of any country in the G7. We are in the 3 largest countries in the world with a AAA credit rating in terms of our credit score, in terms of the confidence the international community has in how sustainable our fiscal track is and how healthy Canada is in terms of our financials. United States, Germany, and Canada. We're the only 3 big countries with AAA credit ratings. So we're doing well at the federal government, but provinces are doing a little bit better, and I think they can step up a bit more as well. And that's what we're going to be talking about them as we renegotiate these health accords. I'm going to keep going around this way. Yes, you. It's on.
Hi. My name is Tara. I'm from one of those very rural areas that you were mentioning in Nova Scotia. And my question for you is a little bit about Veterans Affairs and illegal drugs in Canada. I have a cousin who did 2 tours in Afghanistan who, when he got home, shockingly received a PTSD diagnosis and attempted to get mental health care through Veterans Affairs. He did not. Unsurprisingly, he ended up doing a lot of illegal drugs, and because of that, wasn't able to get any kind of help whatsoever. He ended up committing some crimes, being on the run from things, and last November died in Las Vegas. So my question for you is, when looking at countries like Portugal and Amsterdam who have like decriminalized all like drugs that are here now illegal, and seeing how those crime went down substantially, and thinking of how veterans often have PTSD, Veterans Affairs is very overworked. A lot of veterans, including my cousin, come from very rural areas where we don't have any money. There's like no mental health care. I believe it's a 9+ month wait in my hometown right now. What is it that you are planning to do to support people who have gone out and served our country and who are now dying because they are unable to get access to health care or mental health care? Thank you.
Thank you, Tara. It's a really difficult story to hear, and I really thank you for sharing it, because it's unfortunately an all too common story. We know the impact that serving can have, and certainly during those Afghanistan years had on so many Canadians who, for all the best possible reasons, wanted to step up and serve their country and did so with honor and distinction. And we have a duty of care to our veterans to make sure that we are supporting them and caring for them when they come home. That was something that we stated very clearly and early in our term. We actually reopened the 11 Veterans Affairs offices that the previous government had closed. We invested massively in supports around mental health for veterans. We invested a fresh $10 billion in veterans supports when we first got elected. And there have been significant improvements that unfortunately didn't sound like they either got to your cousin in time or helped. We need to do more on that, and we are certainly continuing to do that. Your question around illegal drugs is a really good one. As many of you know, I made the controversial decision back in 2015 that we were going to legalize marijuana. It was done for a few different reasons. The biggest reason was we felt that public health would be better served if we had a control over the illicit substances that people were buying anyway. If you could make sure that Health Canada approves at least most of it, you know that it's not cut or not dangerous or not as problematic as what is sometimes out there in the market, and would actually allow us to make it more difficult for young people to get it, because before we legalized it, it was easier for a young person to buy a joint than it was to buy a beer, and that didn't seem to be right. That experiment and experience with legalization does inform our thinking going forward, but I will also say that we are not looking at legalization of harder drugs. What we are doing is moving forward in a significant way on what the science tells us are the best ways to support people struggling with addictions. First of all, safe consumption sites. There was one when we came into office in 2015. Now there are dozens and dozens and dozens across the country, and they are saving lives significantly. Needle exchange programs, safe consumption as well, making sure there's a safer supply so people who are addicted can get clean drug supplies as opposed to having to buy the dirty and deadly stuff that is all too often on the streets. There are significant advances made on that. And we're also going a little bit further. The government of British Columbia recently asked us to decriminalize possession of a range of harder drugs because they felt they had the right wraparound services and the community engagement and the support systems that were going to be able to be there to make it part of a healthy process or a health process. I mean, and getting addictions out of the criminal justice system into the healthcare system is what we all know needs to happen, and might have helped out in your family's case. These are things that there is a lot of resistance to. I'll be honest about it. It's not an easy thing, and we still get accused by conservatives in the House of Commons of encouraging hard drug use. Because we are creating supports for people who are addicted. But the science is clear that, and quite frankly, the tragedies that aren't just in the veterans community and aren't just in the inner cities, like in the downtown east side of Vancouver or elsewhere, but are increasingly, someone's on a job site, a good middle-class family on a job site injures their back, gets addicted to painkillers, find themselves in the street, getting drugs off the streets, and gets a bad batch, and fentanyl kills them. These are tragedies that are happening far too often across the country, and we have tools based on science to support people based on leaning in as a community and being there. And a big part of it is understanding that it shouldn't be a criminal issue, it should be a public health issue, and that's one of the areas where I significantly disagree with my Conservative opponent. But thank you very much. Yeah, you in the blue shirt.
Hi there, my name's Jordan. I'm a third-year medical student here at Dalhousie. My question, Alex, it kind of piggybacks on yours with regards to essentially primary prevention. I know myself, being a future prescriber of prescription medications, as it stands right now, we can pat ourselves on the back with our universal healthcare system, but without a universal pharmacare system, at the end of the day, our current system isn't equal and equitable to a lot of our population, and I've seen it firsthand, where I've prescribed a medication to somebody, they come back and say they can't afford it, and we have to essentially give them lesser treatment for something that's more affordable. So I was wondering if you can speak on the government's plans and the federal government's plans for universal health care.
Yeah. As I said earlier, and you're absolutely right about this, Jordan, there is going to be, and we must be thankful for it, significant improvements into pharmacological solutions to problems that right now require either hospitalization or interventions or surgery or those sorts of things, and that is a good thing. We have continued to see massive investments in research into new drugs that is very complex, although I was just down in Toronto at one of our top quantum computing institutions, Xanadu, that is creating a computer that is able to do the kinds of calculations involved in simulating drug trials to be able to test a wide range of different formulations before they actually have to move to the various stages of clinical trials. There is technology that's going to make the drugs that we get and that you will prescribe much, much more effective. And of course, they come with significant research costs, and there is a need to be able to support that innovation in the pharmaceutical industry. At the same time, we need to make sure that we're completing the work of universal health care. Universal health care, when it was first conceived of all those decades ago, was really about doctors in hospitals, and that's it. Thank God our understanding of healthcare is much broader, much more nuanced now, and goes into prevention in all sorts of ways, goes into much better community care and home care and all those sorts of things. But a big piece of it that was left out then was proper pharmacare. We have moved forward in real ways as a government to bring down the cost of prescription drugs. We brought in bulk buying. We've created a Canada Drug Agency to create a Canada-wide list of drugs that should be covered, bringing down the costs of the most expensive drugs and the most common drugs as well. We created a high cost rare disease drug strategies that is there to support, when a province, particularly a smaller province, has maybe 3 people who need a very specific course of very expensive drugs, we know that that's something the federal government can help with and has it. So there's lots of things we're doing. We even moved forward with PharmaCare project in PEI that's been very successful. But again, it's one of those things where there is a huge variance across the country. Quebec, for example, has a very strong pharma system that they are in generally very pleased with. And anytime I say, well, we're talking about national pharmacare, they're like, okay, but don't do it for us, just give us some cash. And other places like BC have great formularies. Other places are a little. So we're trying to bring the country together and make sure that provinces are also stepping up to get that right list the right way. But there's huge things we can do around bulk buying that moves us in that direction, and we're going to keep doing that work. Thank you, Jordan. Another question. Here we go. Yeah, you. Yep.
Thanks for coming today. My name's Karede, first-year medical student. So you talked about your communicating with the different provinces and negotiating several different outcomes and things of that nature. Would you be able to just give me 1 or 2 of those outcomes that you'd be looking at?
Sure.
Yeah.
No, it's a great point. I mean, one of the things that we knew going in to these healthcare renegotiations is the federal government was not going to be dictating how many nurses need to be on duty in a given ward at one moment, or how often a day you should be changing a bedpan, or what kinds of delivery models need to happen in healthcare. Because different provinces will have different ways of solving the same things, and quite frankly, provinces have the expertise on delivering healthcare, not the federal government, so who are we to say that anyway? But our job is to make sure Canadians are getting the right services, the right healthcare across the country. And the way to do that is to really focus on outcomes. So those 4 areas we chose: access to family doctors, better access to mental health care, more support for healthcare workers and therefore a reduction of wait times, and better data, are all things that as those get improved, the results throughout the system will improve. If we're handling mental health better, well, that helps not just the healthcare workers, but it helps patients, it helps communities. If people have access to family doctors that and primary care teams, that really helps significantly as well. So there's a lot of pieces of that go together. However, one province might be at 90% access to primary care physicians already, and another might only be at 70. So they will balance it differently. So part of what the negotiations are with the provinces right now is saying, okay, what is your target that you want to reach for access to primary care? Are you going to aim for 80% access? Are you going to aim for 90% access of the citizens in your province, residents of your province, accessing primary care? So we will say, okay, you're going to get to 90. That sounds reasonable. This is the path you're committing to get on. This is what the interim goals. Great. That'll be part of the deal, and that's the chunk, one of the chunks you're going to use of the billions of dollars we're sending. What do you want to do in terms of mental health? How much? Maybe it's wait times. How long you expect someone to get once they call up in crisis? You can't say, okay, we can get you an appointment with a psychiatrist 6 months from now. And first, like, I'm in crisis now. I need help now. Like, how are we doing that? So getting those metrics down in a way that is appropriate and chosen by the province. Now, if one province says, yeah, we're going to try and get 70% coverage on primary care doctors, and the province next door is saying, yeah, we're getting 90% coverage, I think citizens and residents will be like, wait a second, access to primary care is something we absolutely need. So what we're asking for the provinces is to set those targets that they want and then hit those targets, make them publicly accessible so that they are accountable not to us, but to their residents, to their citizens, and people will have the information, have the data to know whether that's being hit or not. And if other provinces are able to do it with similar pots of money and they're not, well, then there's questions around leadership or allocation of resources that have to happen. But it's not about the federal government demanding specific outcomes. It's about empowering citizens and unions and healthcare professionals and experts and academics to say, yeah, we're not hitting this and we have the data to show it. Because right now it's really hard to get that data. We can't compare apples to apples across the healthcare system. But thank you very much for your questions, Sarday. Yes, you.
Thank you and good afternoon, Mr. Trudeau. My name is Francesca Southwell. I am from the St. Mary's University Students Association. I'm also an international student from the Caribbean island of Antigua and Barbuda.
Beautiful place.
Very beautiful place. Earlier you mentioned that Canada has the highest, highest number of, in terms of education, the OECD. But we also have we rank at the bottom for physicians per capita. So we actually have the lowest number of doctors per patient, basically. And my question is all about concern about the shortage of doctors. I see that in the 1990s, there was a policy to reduce the number of medical students by 10% after the class of, I think it was 1997 or so. And then there's another issue that when it comes to shortage of doctors, around the same policies in the 1990s on restrictions on international medical graduates. I just want to know, how would the government, your government, address the shortage of doctors, and specifically these two policies? Because of course there are a number of them. Thank you.
Thank you, Francesca. First of all, we need to make sure medical schools are expanding, that there are more schools being built, that there are more places in medical schools for the range of medical professionals. That's not something that the federal government does directly. Obviously, it's the province that runs universities and post-secondary educations in their jurisdiction. But it's certainly a conversation we are having with various provinces on how we can help increase the number of doctors. One of the commitments we made in the last election was around adding to the number of doctors, particularly family doctors, across the country. The way to do that, though, is to ensure that there are more spaces in medical schools so more people can go through that and more people see the value in becoming general practitioners and particularly family doctors, because that is unbelievably important as a backbone of our system. The other piece you mentioned, Francesca, is the international credential recognition, and that's something that the federal government does have a role to play on, and that is part of our conversations that we're having with the provinces right now. Recognizing qualifications. I mean, when before I got into politics, I was a high school teacher, and I taught for 5 years out in BC, and then I chose to come home to Montreal, and I wanted to continue my teaching career, and I found out that I'd have to go back to school for a few years, even though I'd started my schooling in Quebec, to qualify, because being a member of the BC College of Teachers didn't automatically apply to being a teacher in Quebec. Even though, and that's one of the reasons why there's a shortage of anyway, we won't get into it, but the shortage of fluent French teachers elsewhere across the country and a shortage of fluent English teachers in Quebec. It seems like there'd be a connection there that one could make, but that's something people are working on as well. Making sure that we're recognizing professional credentials across the country is going to be really important, and that's part of what our challenge is and what we're doing. We're pushing on the provincial bodies that are accountable to that to make sure that they do that. But there's also a process around international credential recognition that is extremely important. Now, we have to make sure that regardless of what country someone was educated in, once they hit a floor or once they hit a clinic, they are just as good and every bit at the level of a Canadian trained practitioner. We wouldn't want someone to start wondering, okay, well, if you were trained elsewhere or if you're from elsewhere, you might not give the same quality of care as someone who went to med school down the road. And that's not something we want in Canada. So we do need to make sure we're hitting those professional qualifications. But there are ways to do it much more efficiently, much more rapidly. You can start doing the training while someone is doing the immigration process, doing online courses from their home overseas so that they land and they just have to do a little practical work. There are ways to recognize credentials a lot quicker, a lot more efficiently if there is an openness to doing that by the provincial bodies that regulate that. And that is something that is at the heart of our conversations that we're having with the provinces now to make sure that that becomes part of the solutions, to take the pressures off the system we have right now. So thank you for bringing that up, Francesca. Yes, you. It's on. It'll turn on in a sec. There you go. Good.
My name is Aparna, and I have the honor and privilege of being the president of the Dalhousie Students Union. I am also a final year industrial engineering student, which has some cool intersections with healthcare in the Atlantic provinces. I want to take a second to actually talk about international students as a key stakeholder in Canada's post-secondary system, as well as how international students are being impacted by the healthcare crisis that we're seeing right now. As we all know, post-secondary education is a provincial responsibility, but immigration itself is a national responsibility, which leads to some gaps in kind of the care and the consistency of outcomes for international students. And we see that some of these gaps that we're seeing in healthcare affects and impacts international students the most. I've had to see situations and circumstances over the last few years where dead international student bodies had to be sent home, and I would never wish that tragedy on anyone. With how the tuition rates are progressing, international students are increasingly subsidizing education for post-secondary students across Canada. Canada is able to remain one of the most educated and the most educated country in the OECD, while also having among the highest, tuition rates, because international students are also putting in and investing so much in our system, and also contributing so much to the economy after they graduate and stay here and contribute to the labor force. What is the federal government doing to address that gap?
No, thank you, Aparna. Great question. International students are an incredibly important part of the Canadian system. Being able to educate people from around the world so that they can come and stay and contribute to our communities and our growth, or return home with the extraordinary education they have and help their home country as well. Either way, that's a great thing. And having those connections to the world is something Canada's always done, and it'll always be really important to make sure we are sharing and participating in the global education of people who will be contributing for decades to come in what is increasingly become a very, very small world. However, the first priority of Canadian institutions and Canadian systems are to make sure that we're giving the best possible education to Canadians. Your parents, for the most part, all paid taxes. You've paid into the system, you're part of this system, and that's why what we're focused on is making sure that education is as affordable as possible for all Canadians. That has to be our priority. Now, yes, we are certainly open to bringing in international students, but let's understand something. Your education, for which you're paying very high tuition rates here in Nova Scotia, is still massively subsidized by the government. International students are paying closer to the unsubsidized actual cost of education, if government is not paying for it with the tax dollars that Canadians contribute to government for people who presumably grew up in Canada or have been naturalized and therefore committed to Canada for their lives because they wanted to become Canadian citizens and will contribute to this country for decades to come. That has to be our priority. And that's why of all the international students who could potentially come to Canada, would be interested in coming to study in our extraordinary universities, we allow ourselves to say it's going to have to be the ones who can pay for it. It's going to be the ones who can buy and need to buy that private insurance to make sure that they're able to access health care with full insurance that doesn't come from the insurance that is given to Canadians because we all pay for it as a society with our choices. So there is something fundamentally different about international students, which doesn't mean that we should just shrug off the very real and increasingly tragic consequences of the pressures that are being put on international students, from that terrible rise in suicides that we're seeing to the institutions that are increasingly defrauding international students by coming to Canada to discover that it's not a real institution and they paid all this money in tuition and they're not going to come away with any sort of diploma. I mean, there are huge, huge problems of exploitation that we need to be addressing. We will continue to be there to value, to support international students. We need to do a lot more about making sure that we're supporting them in their mental health. We need to do that for all students as well. So it's not a problem unique to them. But fundamentally, there is a difference between Canadians and people who are committed to this country and who are anchored in these communities, going to university and making sure it's as affordable as possible, and saying there are so many international students who would like to come to Canada that we're going to have them pay the actual cost of the education they're going to get, or close to the actual cost of the education they're going to get, because if we're going to subsidize, well, we're going to start by subsidizing for Canadians and for people who've come and committed to this country. But thank you for your question. Okay, you. Yeah, in the great glasses.
Thank you. My name is Haley Tatry. I'm a PhD student at Mount St. Vincent University. And when you first started talking, you did twice mention the fact that Canada has universal health care, and that's something we should be proud of. But I don't find that we have universal health care. When I started as a PhD student, I did not have health benefits at first. I had to fight to actually get them. And I didn't go to the dentist during that time. I didn't go to my physiotherapist during that time. I didn't go to my therapist during that time because, frankly, I just couldn't afford it. And this was already addressed a bit earlier, but more specifically, I guess, to dental care and to eye care. So I can pay for these great glasses. Are you going to commit to true universal health care for all Canadians?
Yeah. That's a great question. When healthcare was originally created, as I said, it was very much around an institutional model for doctors in hospitals. It was an important start, but it has been so important that we expanded beyond that. And we have steadily expanded it over time. For reasons that aren't entirely clear, dental and eye care were chosen to be left out of universal coverage. Pharmacare wasn't included in the very beginning, and we're moving to fix that. One of the things that we've done, as you mentioned, is around dental care. We started this year by saying that any families who can't afford to send their kids under 12 to the dentist will be able to. And as we're doing that, and that was something that actually, for uncertain reasons, the Conservatives decided that was an inflationary measure, and they were going to vote against that because, apparently families sending their kids to the dentist is causing inflation, which just sounds like a poor justification for choosing to cut rather than invest and support Canadians. But I'll leave the politics aside for a second. We knew that making sure that people can send their kids to the dentist, because the reality is a lot of people who can't afford to send their kids to the dentist will still send their kids to the dentist and choose to forego other things because it's your kids. You want the very best for them. Well, this will take pressures off of them by making sure that they are actually covered for the cost of sending their kids to the dentist. But that's just a start. We're moving forward next year to everyone who's under 18 who can't afford to go to the dentist, and seniors who can't afford to go to the dentist or don't have dental coverage in some other way, and Canadians living with disabilities who can't afford to go to the dentist, don't have coverage. They will now be able to, at the end of next year, end of this year, be able to afford to go to the dentist. And by the end of the year after that, I believe, or by 2025, we will have universal dental coverage that'll mean that all Canadians will be able to go to the dentist, either because you have health coverage through your work or through an insurance program, or you will be able to be covered by a program that is aligned with the non-insured health benefits program for Indigenous people. For a long time, eyeglasses and dental has been part of the services we offer to Indigenous Canadians, that Indigenous people that we hadn't covered for everyone. So that's one of the pieces we're fixing. Like I said earlier to Jordan, we are moving forward on better access to pharmacare as well, so people don't have to choose between spending on medications and spending for their rent or for their groceries. Eye care is another thing that hopefully future governments will lean in on as well. But in general, I mean, and the other one you mentioned mental health care. It is increasingly understood that mental health care is hugely important as a part of health, as a driver of so many other health outcomes, as an economic challenge. The cost of people taking mental health breaks or being burnt out or overloaded or dealing with mental health issues is massive on our workplaces and on our Canadian economy. We need to be offering better, timely, appropriate care. Maybe it's not always go see a psychiatrist for long sessions of talk therapy. Maybe it's psychologists. Maybe it's life coaches. Maybe it's like there's a range of things. Maybe it's just a family doctor you can talk to regularly that'll help you work things through. I mean, we have to have a much more nuanced approach to these sorts of things, and that also includes better community resilience. I mean, how many of us are trained in first aid? Lots of us. How many of us are trained in mental health first aid? If you're in a bank and you see someone break down in front of you, would you know how to support them through this moment of crisis? How do we make sure we're training up bank tellers and folks in hair and nail salons, or frontline police officers or firefighters to actually be community supporters and community mental first aid as well? I mean, there's a whole shift around holistic approaches to mental health that we need to be moving forward on. There's a lot of great research being done, including right here here at Dal. So these are the kinds of things that we need to keep working on to have a truly universal healthcare system. But if we want to talk about truly universal healthcare system, we also have to remember one of the best things we can do is keep people healthier longer without having to access that system. And that touches on a whole range of things that we can and should be doing to keep people healthy. I think we have time for about one last question, and I'll go to you right here. Right beside you, up to the left.
Hi, my name's Tracy. I am a nursing student here at Dal, and thank you for the opportunity to share this moment with you. So I'm looking at universal healthcare a little. From a personal perspective, I had to wait 11 years for surgery on a wait list here in Nova Scotia, while my oldest child moved to Ontario to get gender reassignment surgery. So at the beginning, you spoke about how you want to make files more accessible between provinces. Would part of that involve being able to, it's the same surgery I could have gone to New Brunswick for and had within 6 months, or gone to Quebec for and had within 6 weeks. So why do we not have a more universal system that would allow people to travel within the provinces to get the health care they need? Because I'm sure that the amount of money that was spent on caring for me while I was waiting for that surgery was far more than it would have been sending me to another province.
Yeah. No, listen, Tracy, thank you. Thanks for sharing that story. And you're right, it doesn't make a whole lot of sense. But it's not just about you not being able to travel for it. It's also about the doctors not being able to travel for it. Or it's also about knowing that we have very, very siloed medical systems. My friend Dominic LeBlanc, our Minister of Infrastructure, was very successfully diagnosed and treated for a very aggressive form of cancer a few years ago at the Moncton Hospital, but then had to get sent to Quebec to see a specialist because there weren't specialists there. And the doctors in Moncton were very happy to refer him to this great specialist in a great hospital in Montreal. But that same doctor that they were referring to never would have been able to come and deliver healthcare services in Moncton, because that wouldn't have been allowed because of the provincial rules. And that's where national licensing makes a whole lot more sense. If someone is a successful doctor in Saskatchewan, they should be able to be a successful doctor in Ontario or Quebec or PEI or wherever. And breaking down these silos is going to be a really important part of making sure that that spirit of what the federal government has to ensure with the Canada Health Act, which is that people can get an equivalent quality of care right across the country, is actually met. Now, different provinces are different. There are higher concentrations of seniors in some of the Atlantic provinces. There are more new Canadians of particular backgrounds in other provinces. There's different demographic realities across the country that, in some cases, will lead to varying choices of approaches, because every system has to make choices. Can we do something that makes a little more sense? Can we do something that understands that a Canadian is a Canadian, whichever province they happen to live in, and people should have similar access to care? Like, there are so many stories, and I'm sure you know some as well, of people who specifically move to a different province so they can get the right kinds of treatments for their kid who has a rare disease or is struggling with autism or whatever it is, that have better services in different parts of the country. We should be able to catch up. If one part of the country is doing particularly well with a type of services that is really effective as a treatment, then the other parts of the country should know that and say, okay, we're going to take that on as well. And that's where sharing health information and sharing data around what's working to create efficiencies in this, to create abilities to know, okay, this really works well. This, what we're doing, doesn't work as well. Let's take that model because it works over there, and we'll adapt it to where we're doing. Having better information about healthcare, having better understanding about where the outcomes are, so that it's not just you alone saying that, but a larger number of populations about to go into the voting booth saying, yeah, we don't have the same caliber of outcomes in our healthcare system as they do just across the river or across the border. Let's make sure that you as a government, as a provincial government, are committed to changing that. That's how we make changes. And one of the things that I'm trying to do as a federal leader is make it easier for people to see where there are gaps in the system. So it's not just individual experiences that are very difficult for individuals to carry, but don't necessarily get the coverage or the amplification or the universality of story that would happen if there were clear numbers on what's happening here, what's not happening there. So the genius of Canada is that we have different provinces that do things differently, and that allows for a lot of flexibility and a lot of learning and a lot of appropriateness across the country. But it only really works if we can then properly compare and realize, okay, let's take the best of what works everywhere across the country. And I think that's a significant driver of what we're trying to achieve with these this particular approach to health accords. And I certainly hope that it has impacts on you all in your lives now, but I certainly know it will have positive impacts on future generations who won't have to go through the same kinds of challenges that you did, because that's what we should always want. Let's improve the system so we learn from the things that are challenging for us so we can deliver better outcomes for people in the future. But thank you very much for your question, Tracy. And thank you all. Thank you all for taking the time out of your day to come and engage in this conversation on healthcare and on a range of things. I really look forward to continuing these conversations, but I mostly look forward to watching you over the coming years as you continue to step up as professionals, not just in healthcare, but in art and design and engineering and all the different things that you're going to be doing throughout your exciting lives. And I really hope you appreciated and learned almost as much as I did from this opportunity, because I always get the most out of it from hearing what's going on in the people I talk to. So, merci beaucoup tout le monde. Merci d'avoir été ici aujourd'hui et à la prochaine. Thank you all.
Thank you very much for an engaging conversation, and our Nova Scotian students, who I don't think were easy on you, really great questions, and I'm very appreciative of those questions. And I have one tiny request. As a Dean of Health at a student town hall focused on health with the Prime Minister, it feels like the perfect opportunity for a selfie. And I'm wondering if you would indulge me.
Okay.
Okay. Thank you very much, and thank you all.